In September, Massachusetts Governor Charlie Baker announced a temporary yet controversial ban on the sale of vaping products. According to the Centers for Disease Control, there have been more than 1,800 vaping-related illnesses across the country and 37 deaths nationwide. Carolee McGrath sat down with Alane Burgess of the Mental Health Association's Best Life Center to discuss the emotional and psychological factors behind vaping.
A lot of kids are starting vaping because there's a very strong social component to the vaping. Just like when a lot of us were younger, smoking cigarettes might have been the in thing to do. That's transitioned now to having the vaping products where there's such a socialization around them. So a lot of kids are starting vaping for, it could be mere curiosity because they're witnessing family members or their friends doing it. They may be struggling with some type of a stress or anxiety where they're hearing people say, oh, I feel so much better and so much more relaxed after I use the vape. Or there's the socialization piece where all of their friends are doing it. So they're curious and they want to see what it feels like and what it looks like. And we all know that with the socialization piece, a lot of really good conversations or things can happen within the context of being around, whether it be a cigarette or the vaping device. So kids are more prone to being part of that social circle, and if they're excluded from that, then they may not be feeling as if though they're part of.
So they feel like they have to do it just because the crowd's doing it.
Yes.
Right, which is really, I mean, the case for so many different things that you face when you're a kid and a teenager. Yeah. So they're not turning to cigarettes because that's sort of like passé for them, right? The
yes.
vaping, this is kind of their new thing.
This is their new thing.
How long does it take them to go from social to addicted?
It's different for everybody, but what they show is after somebody has started using products within 3 to 6 months, that there's actually different structural changes that start occurring in our brain and our synapses that then start going to the addiction piece. Vaping can actually be a little bit quicker because for one vape pod is equivalent to a pack of cigarettes, and 3 hits of one vape product is equivalent to 1 full cigarette. So since they're actually getting higher concentrations of nicotine and a much quicker route, it's actually the brain is developing much more of a stronger structural change that very quickly will then say, well, I need this in order to maintain a stability so that I'm not feeling withdrawal.
But when vaping products were first rolled out, it was really used to help people get off of cigarettes, and people have said it has helped them. Yeah. Have you seen that in your experience?
Not at all.
Not at all.
Not at all. So what it has been is it was designed, as you're saying, you're completely right, it was marketed as this is a healthier alternative or this is a way to help you to quit smoking, but it was never approved to be advertised or marketed as any type of a nicotine replacement therapy. What it was is more of a substitution device that really almost gave the psychological marketing stigma that this is supposed to be better or healthier. And where it has, I believe, really sold to the younger population is because it doesn't have the smell or the odor, so it's much easier to be able to hide.
And they do it in class. They can do it right in class
with
their little,
yeah.
What are they, I mean, they look like, you know, just tiny little things that
yes.
people wouldn't know.
Yes. So the Juul, which is the most popular brand of the e-cigarettes, they're showing about 80 to 85% of users are using the Juul product. The Juuls look like flash drives. So it's very easy for the younger kids to be able to take these devices into school, and they can take a hit off of their Juul product, and it doesn't eliminate the clouds of the smoke that we see with other e-cigarette devices. So they can very easily put their shirt up, blow into their shirt, and there's no smoke, there's no smell. So the teachers or other people won't even be able to tell that they're using these devices.
And so what's the next step for them? They start with the tobacco products, but obviously they could be vaping marijuana products next. Is that sort of like the next logical thing that kids are doing?
Absolutely. And what they're also finding too is about 75% to even, I was reading last night, even up to 86% now of folks that are using the vaping devices, they're actually finding that they're using them with THC, whether it's THC solo and or THC and nicotine combined. So about 75% is actually THC being used in these vaping devices versus the nicotine pods.
So the governor enacted a temporary ban on vaping products, very controversial.
Yeah.
He's had a lot of pushback on that. And obviously that was in response to vaping-related deaths across the country.
Yes.
Was this the right response?
I think it was a great response to be able to allow us to really be able to look more closely at what is going on or what could potentially be going on. I think it will allow us to be able to have more conversations and certainly really now be able to take that step back and be able to say, now these devices are not as safe as they were once marketed when they first came out, and it can provide us the opportunities to be able to have the discussions about quitting these products altogether, what resources are available for quitting. But the reality and truth is, what they're now finding is, for anybody who's addicted to any product, they're always going to go find it wherever they can find it. So what that means is they're crossing state lines going to Connecticut. So now Connecticut's sales for the vape products have tripled. There's also availability to be able to order these devices or the juices online. So they don't even have to leave the house. They could be doing the online shopping and the online ordering where these products are coming directly to their homes.
And in addition, the CDC is reporting that most of these deaths were related to THC product being used in the vaping device as well.
Right. And what the CDC reports is they actually say that they don't know exactly what it is that's causing. And they have found that in all of the cases that THC has been found, but they're not saying that THC is the reason. Because the problem becomes with all of these juices, when you're talking about e-cigarettes, there's over 15,000 different types of flavors available. The Juul comes with about 5 different flavors available. None of these products are regulated by the FDA. And the people who are actually selling the products, they're also not regulated to list every single ingredient that is in these products. So therefore, the only way that the CDC is going to be able to determine what may potentially be causing for the deaths is by doing an extensive laboratory research, but they still don't know, is it the vape? Is it the juices? What is happening? What they have been able to determine is a lot of these products are actually penetrating much deeper into our lungs. And what's happening is they're producing what looks like chemical burns. And with the chemical burns, it's permanent scar tissuing. The important thing I think also that I'd like to note is that they also say that this is not something that is occurring, over months of use. This is actually something that they're saying happens very rapidly and quickly within days. So somebody could come down with what feels like pneumonia or bronchitis and really start having an inability to be able to breathe. They're talking about a lot of pain. And if they're feeling that, the advice is really get to the doctor immediately, because it may not be pneumonia, it may not be a cold, but it may actually be something from the vaping product that is very quickly deteriorating in the person's body. And people have been known to, unfortunately, be in the ICU within 3 to 7 days of these symptoms starting.